Hi, myself Alpina. I think on September 18th, our son was diagnosed with fever and a little bit cold cough. So we came to Rainbow Hospital in Banakata, Bangalore. And then initially we had, we consulted with some doctors and they thought it was a viral infection. And since the fever was not coming down, we again went to another doctor, which is Dr. Anupam, and also Dr. Prakash. And then finally, it was diagnosed that our baby was having adenovirus, which caused viral pneumonia.
Which is very mild actually.
Yeah,
they thought it was mild.
The doctors said initially everybody thought the infection was a moderate infection, but then later on, after 2 to 3 days in PICU, everybody thought the fever was down, everything was coming to normal, but unfortunately things were getting upside down. Yeah, it was going very worse. So Dr. Anupam, again, he diagnosed everything, he checked everything and then came to a conclusion that the adenovirus has spread so much that the total number was about 2.5 crores actually.
And that too in his bloodstream.
Yeah, in his bloodstream. So anything can happen. So initially, as a parents, we were both shattered down. We didn't know what to do. We actually, to be very frank, we lost our hope. And Dr. Anupam said to us that have faith in us, believe us. And the way he communicated that time, it was, for us, he was a God. So it was like God speaking to us, have faith in hospital, have faith in the doctors, everything will be fine. And we did it. We just blindly did it. And now we are so much happy after 11 days or 12 days in this hospital.
And that went 10 days in ICU.
Yeah, 10 days in ICU. We are finally coming out. And staying inside an ICU is not an easy task. We didn't know the pain till now. Okay. And now we know what each and every parent is going through.
We had so much experience and we were in a very horrible state of mind.
Yeah.
As if new parents are seeing this video, I would perfectly understand what exactly the situations or the mental state would go through. There is no scope of logical thinking in your brain when your mind is down.
So this hospital is such a good hospital this is especially for kids.
Yes.
So one of the best decisions that we have made in our life is getting our kid here and staying in this hospital and having faith in the doctors and this hospitals. And we have seen the effort that each and every doctors and nurses are putting here. The nurses, I should say, our sister Suja sister is one of the best, I would say, in the ICU. And she makes our kid very friendly, calm, happy. She gives chocolates, everything. I don't know. Words cannot be enough to explain.
There is always a skill when it deals with children, and that is there.
That skill is there in this hospital.
I'm going to speak about Ray, who had come to us with a bad adenoviral infection. He came in unwell and started having respiratory distress or fast breathing. Initially showed a little recovery and then started deteriorating, and he needed non-invasive ventilation. And at that point, because of his clinical deterioration as well as him being unwell, we, from our previous experience and knowledge and from knowing from how these cases can be, how things can deteriorate and how they can become unwell, so we did a particular test for PCR and quantitative adenoviral load, and it was quite high, which is 2.68 crores, which is associated with very severe form of disease or even death for that matter. So we got this particular early diagnosis, early load, and then we spoke to the family and gave him something called cidofovir, which is an antiviral drug. And because we were able to identify it early and had the window period where we could give it early, he showed a very good recovery and came off the non-invasive ventilation, recovered, and he stayed totally for about 12 days in hospital. However, he made a very good recovery and we've discharged him. and he's doing well. So it just emphasizes the importance of referring a child to the intensive care early. And because we have all the knowledge, expertise, skills, and facilities here, we were not only able to identify how he was deteriorating, but also counter it with aggressive treatment and deliver these drugs called cidofovir, as well as other supportive measures to him. And that really helped the child and the family and made us very proud of our services, and we are very happy to share the story with you.
One day, I was actually shocked seeing Anupam doctor. I think he literally worked for almost more than 24 hours. He was working, and then even after all this, hectic schedules, he's coming and speaking to us as very calmly, and he's explaining all the situation. So that much hard work and effort the doctors are putting on in this hospital. So definitely it's just that you have to believe in this hospital and the doctors. And if your kid is sick, don't worry, don't be tensed. Just believe in the hospital and the doctors.